So placenta abruption is another placental complication. That is a premature separation of a normally implanted placenta from the decidual lining of the uterus. And that only happens about 0.3 to 1 time out of 100 births, but it does happen. It's something that you need to know about. The classic sign for third trimester placental abruption is bleeding and severe abdominal pain. So there'll be uterine tenderness, she'll have a board-like abdomen, fetal compromise. So if you put the baby on the monitor, you might see decels, you might see low fetal heart rate, you might see a lack of variability. You might have bleeding or you might not have bleeding, depending on where the abruption is, which I'll show you on the next slide. So whereas painless, bright red bleeding is almost always, you're thinking placenta previa, the difference between a placenta previa and an abruption is, for an abruption, your patient's going to have pain, and you might see blood or you might not see blood. It all depends on where the abruption is happening. And again, if this is our lifeline, if this is how the fetus is getting its oxygen and getting its nutrients and getting its, gas exchange and, getting rid of waste, and it prematurely comes apart from that uterus, you have minutes before that fetus needs to be born. So I'll just show you here. So there's mid-grade, moderate grade. So you can see how this little pocket's kind of up there. So, this might be coming off. You might not see any bleeding. Here it's moderately. So the placenta's, halfway coming off of that lining, and you're seeing an apparent hemorrhage. And then this is more than 50% coming apart. Placenta's separating, but you don't see that hemorrhage. So it depends. There's 3 grades. But for the most part, if you're feeling any kind of, board-like abdomen, uterine tenderness, and the baby's not really showing good signs, you're going to look on an ultrasound to see what's happening. Again, you're not going to do any cervical exams if you do see bleeding. So risk factors for an abruption are domestic violence, maternal hypertension, cigarette smoking, again, anything that can cause that vasoconstriction and can cause that placenta to come, detached from that lining of the uterus. Twins or triplets, cocaine use. So again, it depends on the type of abruption, what your care is going to be. Most of these women will get a non-stress test, which again is putting them on the monitor, putting the ultrasound on, putting the toco on, seeing what's happening during contractions, and it depends on the degree. So there's a lot of abruptions can be small. Sometimes you might not even see an abruption until, the placenta comes out after delivery and you see a small infarct, and, that's sort of, diagnosed retroactively. If there's active bleeding, you're going to administer IV fluids. Again, she's going to have a lab workup. She's going to be given Rogam if she's Rh negative. If she's preterm, she's going to be given betamethasone to promote fetal lung maturity. You're going to have continuous fetal monitoring on these patients, continuous patient support, and possibly a C-section delivery, depending on how the grade of the placenta abruption, how the infant's doing, how old the fetus is, etc. So your takeaway again is, if you see bleeding, you're not going to do vaginal exams. The differences between placenta previa and placenta abruption are previa is, that placenta is before the cervix, so it's just previous. It's kind of where it's a little bit ahead of the baby, to say, or the fetus. And abruption is, it's pulling apart. So if you think of the word abrupt, that's kind of like a harsh word. So an abruption is it's pulling apart from that uterus prematurely, which, as again, we talked about, if that's that fetus's lifelines, if that's how it's getting oxygen and nutrients, you only have minutes before you really need to deliver that baby and get it on the outside and have an external transition. So maternal mortality ranges from 0.5 to 5% with an abruption, and the degree of hemorrhage from the torn vessels varies. So you could have mild maternal anemia, or you could have maternal shock, acute renal failure, and death in severe cases. It all depends on, the degree of how much of that placenta is pulling apart from that uterus. So fetal mortality is about 35% in all. It can be as high as 50 to 80% when it's associated with severe placental abruption. Again, you only have minutes before that baby or before that fetus really doesn't have any oxygen supply.